Hi there, classmates. This is Michelle Hewlett, and this is my DXR case, Barron, for Nursing 630. So to begin, I'm going to talk about the chief complaint of Barron, and his was lower back pain and history of present illness. So I went through my old carts. Onset was, he said, 2 months ago. Location, the lower back. Duration, all he said was it's been 2 months, and didn't give much detail beyond that. The character, he said he was unable to describe the pain, but it just hurts. The aggravating and relieving factors, no aggravating factors, but relieving, he said with the relieving factors, he tried Tylenol without any relief there. And then timing, all he said was it's just been 2 months that he's had this pain. And then severity, all he said was, I'm in terrible pain. So then moving on to past medical history, he didn't have any, no allergies. For medications, he was just taking aspirin for joint pain, and then of course the Tylenol for his back pain that wasn't really working. And then family history, all he said was his father had passed away from a heart attack at 47. And then his mom is alive but depressed from the passing of his father. And then he has a 28-year-old brother who's alive and well. So nothing super significant there. And then social history. Just a side note, I mistakenly forgot to ask about his smoking and alcohol history, so that was my bad. And then sorry, my Siri's talking. So I asked him about his occupation. He's an accountant, works like 9 to 5, Monday to Friday. So I'm guessing he is sitting a lot, not super active. And on his free time, he says he comes home from work and relaxes with his wife, makes dinner, or he'll go out with friends. So nothing too crazy there. And then he said in regards to like exercise, that he's active during the summer, being outside gardening, but during the winter he's not as active. But it doesn't sound like he has like a routine exercise pattern there. And then going on to the review of systems. So I'm just going to list off everything that I asked him, but there was no trauma. He didn't have any fevers or chills, no night sweats, no fatigue, no rash, no cough. He did have joint pain in the back, no urinary or fecal incontinence or issues there. His appetite was normal, no weight changes, no recent infections, no muscle weakness, no erectile dysfunction. He did have numbness in the left foot, no dizziness, and then pain. He did have pain with movement in the lower back. And then his physical assessment, so his vitals were normal other than his blood pressure, which was elevated. And BMI was normal. Musculoskeletal examination. So I did more of a focus examination, starting with the musculoskeletal exam. So I looked at any joint swelling, edema, and there was none there. There didn't appear to be any fractures, sprains, or dislocations of any sort. His gait was abnormal in that during the heel to toe walking, he did have a high step on the left side. And then he did say he had a hard time moving around because of the back pain. So I guess that's also related to his gait being abnormal. And then I looked at his extremities. No, he didn't have any claudication. His temperature was normal in his extremities, like no cold hands or feet or anything like that. He did have, for the DTRs, his patellar reflex on the left was absent, while on the right it was +1, and then Achilles was +2 on the right, and then absent on the left. And then I did a neuro exam where he didn't have any balance issues with the Romberg. Like I said, the heel to toe, he did have a high step on the left side. And then I did a straight leg exam, and he did experience pain at 30 degrees elevation in both legs, but normal sensation in both the right and left foot. So I had 4 differential diagnoses. So my first one was the radiculopathy, protruded disc and or herniated disc with sciatica pain. My second was the spinal stenosis, third cauda equina, and then fourth was fractured vertebrae. So what I did initially was I decided to do an MRI, but that wasn't working. So then I moved to a CT, and basically my CT told me everything that I needed to know. So basically the CT showed that he had a left-sided herniation at the L5-S1 disc that caused the compromise of the left nerve root canal. And there was no masses, lesions, fracture, stenosis, anything like that. And then so basically with that, I was like, all right, this is clearly radiculopathy, protruded disc with the nerve root pain on the left side. So that was my diagnosis. And basically to negate my differential diagnosis, the CT kind of did all that for me. And then I decided to treat outpatient. So education-wise for him, I didn't want him on bed rest because, in class we were told bed rest is not good. But I was thinking still walk around, take it easy. And then once your pain is gone and resolved, then we can start doing a regular routine exercise, 3 to 5 days a week, 30 minutes at a time. And then I said, definitely go to a physical therapist, try NSAIDs, and I was thinking to prescribe a muscle relaxer and a consult with an orthopedic surgeon in case he did need surgery. And then I'm trying to think what else. Oh, the DXR said to prescribe a narcotic possibly. And I thought I was going to wait a little bit. I forgot to mention I was going to follow up with him in a couple days to see how the muscle relaxers were doing, how his pain was, and then if he was still experiencing pain to prescribe the narcotic medication. But the DXR said that I should prescribe a narcotic, and then they also said a laxative, I guess, for constipation, but I never really felt like he was constipated because I did ask about his bowels and they were normal. And then they also recommended a neuromuscular anesthetic, which I also think is a little extreme, but hey, something worth considering. My pearls of wisdom for the case, and then how I ruled out my differentials. So basically, like I said earlier, the CT scan kind of confirmed my diagnosis and ruled out the other ones right then and there. But basically, for cauda equina, he didn't have any urinary or bowel incontinence, and it wasn't bilateral numbness. And then with the fracture, the CT said there was no fracture there. And then with the stenosis, same thing. The CT said there was no stenosis there, so made that easy. And then for pricing of the CT, I think the DXR said it was around $375. And then I looked it up, and the pricing, that's pretty accurate. It's about $270 to $5,000 out of pocket for a CT scan. The MRI was, I think, a couple $1,000, so I guess it kind of worked out for pricing wise, the MRI scan was down. But, you know, the CT scan gives off a lot of radiation. So there's that negative with that. And then things I should have done. I didn't ask about his tobacco use. And I guess that is a big part of increasing his risk for the herniated disc. And I didn't ask about that because it seems like from the DXR that he did use quite a bit of tobacco. And I would have counseled him about, you know, not smoking as much, trying to quit smoking, etc. And then the DXR said I should have, which maybe I just didn't see the button. I'm not sure why I didn't do this, but I didn't do, you know, the range of motion in his toes or feet. And I guess they were normal, but that was something I should have done. And then same with the range of motion with the spine. I should have done that. And DXR said that was normal as well, but something I should have looked into. Or I'm sorry, I think it said the spine there was limited range of motion in the spine. So that's important to know. I think that is pretty much it. So really my CT confirmed everything for me. So it was a pretty interesting case, and I definitely had a great experience using the DXR. I hope you like my presentation, and I look forward to watching your videos as well. Thank you. Bye.